Okay. Hello, dancers, and thank you for taking the time to join me as we discuss dance injury prevention in the foot and ankle. My name is Andrew Cook, and I put together this webinar to really highlight the fact that, even though we aren't in the studio and able to dance in the traditional sense, this doesn't really have to be considered lost time completely. And in fact, it might be kind of a good opportunity to work on those areas that may be lacking or areas of weakness that we've kind of been just glossing over or compensations that we can correct because that will in the end make us even stronger and healthier dancers. So as we get started, a little bit of background about me. I grew up dancing and I first got my BFA in dance from Chapman University, and I was able to dance professionally in Southern California and then New York City before I went on to become a physical therapist, and I received my doctorate of physical therapy from the MGH Institute of Health Professions. I'm board certified in orthopedic physical therapy, and I've specialized in the treatment of dancers. I work at Complete Game Physical Therapy. We're located in Lowell, Massachusetts, and we're an outpatient sports performance and dance physical therapy clinic. And if you do have any questions about the talk today, please feel free to direct them to your teachers, who can then contact me, or you can contact me directly at the clinic with the number listed there, 978-710-7204, or you can email me at acook@completegamept.com. So, objectives for today. We want to review the importance of injury prevention and cross-training strategies. Want to provide quick screens that you can do right now at home as you listen to this to help identify movement deficits. And then we want to review exercises to help reduce the likelihood of injury and to improve in performance as you get back to dance and as you get back to rehearsals and performances when all this ends. So, let's get started by reviewing some risk factors associated with the foot and ankle injuries, and then we can discuss how to reduce these risk factors. For instance, one risk factor would be impaired balance strategies. So that means if you're balancing on one leg, whether you're in coupe or passe, or you're landing from a jump, or you're turning, if you find that your ankle and foot are constantly moving around excessively, this would be that your body is not quite using the correct balance strategies in order to maintain a stable foot and ankle. The next thing might be there's just weakness in the foot and ankle and just needs to be stronger in order to support the demands of dance. Another possibility may be there's just a lack of core strength, and we're looking a little bit more proximally here, but if you have a strong core, it makes it a lot easier for your foot and ankle to do their job. So it's always important to have a strong core and make sure that you're using it as you dance and as you prepare. The final thing is overstretching, and that can even potentially lead to instability, and not just in the ankle, but really in the rest of the body as well. And the benefits of any stretch are usually achieved within the first 30 to 40 seconds of holding a stretch. So it's never really a good idea to hold a stretch longer than 30 to 40 seconds, because you may end up doing more harm by stretching structures in the body that shouldn't necessarily be stretched and creating more instability in a joint when you don't have enough strength to really back it up. So, if one of the risk factors for ankle injuries is limited balance endurance, or some of those strategies might be impaired, then we should first test your balance to see if you are at increased risk. An easy way to do that, and this setting, is a single leg balance test. So I really want to make this webinar as interactive as possible. So please feel free to join in, and I think you'll get the most benefit out of this time together if you do actually try to participate and stand up instead of just listening. And we're also dancers, by the way, so we're made to move and want to move, so let's get up. So the goal with this test is to see how long you can, with good stability, balance on one leg with these different constraints. So I want you to stand in the middle of the room and be barefoot. So take off your shoes, take off your socks. And the first leg we're going to test is your right leg. So you're going to stand on your right leg, and then you're going to lift your left leg off the floor. And it's important to keep your hips level. And you don't have to go up into a passe or anything. You just want to kind of hold the left leg off the floor. And then we're going to attempt to hold this position for 10 seconds. And then after 10 seconds, without changing anything, you're just going to close your eyes and balance for 10 more seconds. Okay? So we're going to give it a shot. We're going to start in 5 seconds. 4, 3, 2, 1, and go. Balance on one leg. Keep balancing. And now I want you to close your eyes and keep balancing. A few more seconds. Keep balancing. Good, and you can rest. So be honest with yourself, because there's no one around to judge. But it's important to really be honest with how you score this. So did you lose your balance at any point, either with the eyes open or the eyes closed? If you didn't lose your balance, did you feel like you were wiggling a lot? Would you have to hop? Did you feel like your ankle was constantly moving back and forth to keep you from losing your balance? Or did you feel unsteady? If any of those were correct, or if you said yes to any of those, then that would be a positive test, and that would indicate that we need to work a little bit more on your balance to keep you at minimal risk for getting an ankle injury. So now let's test the other side. Ready, set, go. So you're going to balance on your left leg. And then keep balancing and close your eyes. And rest. Good. Same questions as the right side. Did you lose your balance? Did you wiggle? Did you have to kind of jump around in order to stay on one leg? And did you feel unsteady? Did you feel confident the whole time? If you answered yes to any of that, then we would say that this is a positive test. And if there was any sort of big difference on your right versus your left, that would also be a positive test. So, if we found that your balance during that test wasn't as good as you had hoped, I've selected a few exercises to improve your balance for two major reasons. One, we want to reduce the risk of an injury. And two, more importantly for you right now, better balance will directly improve your technique and your dance ability. So the first one here is a single leg deadlift, or kind of a bad penché performed in parallel. So you're going to be balancing on one leg, and you want to bend at the hips and slowly tilt your body forward while you're extending the back leg behind you. And then you're going to return up to the starting position. So the tip is to keep your back straight, and you also don't want to allow that knee to collapse in as you're bending forward into that penché position. Play it again. And you can do this one with the knee straight or the knee bent. And you want to do 10 slow reps. So balance is really developed by doing slow movement, because then you can't cheat as easily. And once you feel like you can do 10 slow reps without losing your balance, without putting a leg down, the advanced version would be to try it with the eyes closed, which is a lot harder to do because we use our eyes a lot for maintaining balance. Next one, foot doming. So this is to develop some of the small muscles inside your foot, and I know a lot of studios are already teaching this, and I think this is an excellent exercise to do to help with foot stability and ankle stability, and to help with your balance and your control as a dancer. So the idea is to, without curling the toes, we want to try to lift the arch up slowly and then slowly drop the arch back down. So the toes have to stay on the floor, the heel has to stay on the floor. We don't want to think of gripping or curling the toes, as I said already. And it's a pretty small movement, and I know this video is hard really to see, but you can kind of see a little tightness developing around the arch of the foot as the arch goes up and then lowers down. The best way to start this exercise is to do it in sitting. I think it's an easier way to develop your control. And then you can progress it by doing it in standing, and then you can start to incorporate it into, more dance-specific movements like pliés, tendus, dégagés, and then you can start bringing it into more dynamic movements that you're bringing across the floor or during any portion of your dance class. So next we want to assess the strength of your calf muscle, because we know that if there's weakness in your calf muscle, then that's going to put you at increased risk for a foot or ankle injury. So the goal here is to test how many elevates can you do without resting, without dropping down the height of your elevate, in order to determine how strong that muscle is and how much endurance it has. So again, we're going to perform this one barefoot. And you can have your hands gently resting on a wall, or if you have a bar, you can rest your hands gently on a bar. And we'll do the right leg first, so you're going to balance on the right leg, and your left leg is off the floor without touching. So kind of in a coupe position, but we're going to be parallel, and you're going to just slightly slide the coupe leg out to the side so it's just kind of hanging in space. And then we want to make sure the hips stay level and your knee stays straight. So we're going to elevate slowly all the way up and then slowly back down. And then I want you to repeat this as many times as possible, keeping that same tempo. Up and down, up and down. And then count the number of repetitions you can do. And you're going to stop counting once you can no longer rise to the same height as the first repetition, or if you get so fatigued you can't do any more, or if you start to get pain. So I'll give you about a minute. Try to do as many as you can in that time. We also still want to make sure that the form is good the whole time. Strength is important, but we also want to make sure that we're keeping good alignment as we're testing the strength of these muscles. Okay, good. Now let's test the other side. So you're going to stand on your left leg, soft hands on the bar or the wall, and then slowly rise into an elevate all the way up, all the way down. Keep going. Okay, so feel free to pause the webinar if you find that I didn't give you enough time and you want to kind of go back and make sure that you do these tests correctly, and that way you're also getting an accurate number of repetitions to determine if there's any sort of weakness or difficulty with this. So feel free to pause and play as we move forward. So the question is, how many reps were you able to do? And was there a big difference between each side? Did you feel like after you did a couple, they were easy, and then as you started doing a few more, it got harder and harder, and then that heel wasn't quite going up as high, you weren't able to keep the same sort of tempo? Any of those answers, yes, would mean that maybe there's some weakness that we need to work on in your calf muscle in order to keep that area nice and strong and stable. So the best way to strengthen your calf is to take the test and start doing it as an exercise. So single leg elevates, and there's a lot of professional companies that are starting to just incorporate this exercise into their regular bar routine or their company rehearsals. And all you do is just stand on one leg, elevate all the way up, all the way down, performing it slowly. Start with 2 sets of 10 repetitions, and then you want to slowly add more each week, and not adding too much at any one time because we don't want to overload the muscles. We want to slowly build up your strength. So 2 sets of 10 is kind of just a generic starting point. If you found that you were having a lot of difficulty with doing the heel raises right away, start with a smaller number. If you found that it was pretty easy and you could already kind of do 15 reps today, then start with 15. So gauge it to what feels best for you. And again, the importance is that we're going slow up and down and that you're maintaining that nice alignment as you go up and down. You don't want to let that heel fall into a sickle position, and you don't want to kind of move too far into a bevel position. You want straight up and down the whole time. Next, it's important to have a strong core in order to help out the foot and ankle as they do their job in maintaining your balance. So I've kind of included a pretty standard core exercise. A lot of you probably are already doing something like this or similar. The key is with any sort of abdominal exercise is drawing in the core muscles and not letting them push out, and not allowing your back or your hips to change position as you're moving your arms and legs. So again, it's important to perform these slowly and to make sure that you're keeping those abdominal muscles engaged the whole time. So the dead bug is just lying on your back. You start with the knees bent and your arms in kind of a first position, and then in opposition you're going to slowly move one arm overhead as you straighten the opposite leg at the same time, and then you return to the starting position and repeat on the other side. So again, making sure that the abdominals are drawn in the whole time, and you're not allowing your back to arch, and you're not allowing your hips to move into a tilt in any way. So, takeaways for today. Based on the couple screens that we did, if you identified any weakness, you should work on it, especially now when you have the time to work on it. And this is going to make you a better dancer and less prone to injury. So, many reasons to work on this. And just remember, the keys for this webinar to reducing foot and ankle injuries are: we want to have a strong single leg balance. You should be able to balance easily with your eyes open and easily with your eyes closed without a lot of movement, and not losing your balance or having to step to maintain your balance. And we want to make sure that you have a strong calf muscle, so that way you can keep good stability through your ankle and foot. And then we also want to avoid overstretching, as we talked about earlier. It's a good idea to stretch, but not stretching for the sake of stretching, and not stretching for long periods of time, because we don't want to create instability. We don't want the joint to be loose. And then also, we want all dancers to be participating in some sort of comprehensive cross-training program. And this should really be in addition to your technique classes. So that can be a number of things: Pilates, gyrotonic, yoga, weightlifting, strength training, anything that you find that makes you happy, that challenges your body, that makes you load your body so it's going to make you stronger, is going to help you as a dancer. And it's going to make you stronger, it's going to make your extensions better, it's going to make you more resilient to injury, it's going to improve your technique. So I can't stress enough how important it is for every dancer to be doing some sort of cross training. And then again, if you do have any questions at all, feel free to reach out to me. If you have questions about, dance rehab in general, or if you want some sort of free screening, if you're worried about an injury that's been kind of nagging you before all of this took place, this is their time to really deal with it. So that way when we are able to get back in the studio and start performing, you'll be primed and ready to go. So you can reach me at acook@completegamept.com. And thank you so much for your time. And again, if you have any questions, don't hesitate to reach out. Take care, everybody. Stay safe.